Mr. Stephen, a 72-year-old man who had a motor vehicle accident a few months ago, was diagnosed with depression and an anxiety disorder. Mr. Stephen had an amputation on his left leg due to the trauma from the accident. He was discharged from the nursing facility after 2 years. He moved to a subsidized, low-income apartment where he receives home care services, including house cleaning, shopping, bath support, and a lifeline for emergencies. Prior to discharge, the nursing facility social services staff, with Mr. Stephen's permission, spoke with the apartment complex director to inform him of Mr. Stephen's condition and needs. The director agreed to call Mr. Stephen's case manager or Adult Protective Services if he ever noticed problems. He also installed bath support bars and found an apartment with lower carpet so that Mr. Stephen could maneuver his wheelchair safely. The physical therapist during a home evaluation had recommended these modifications during an assessment. An evaluation of the apartment was also completed by an occupational therapist and a social worker with Mr. Stephen. This helped determine the placement of rugs and ensured Mr. Stephen could easily access the bathroom and kitchen. To manage symptoms of bipolar depression and anxiety disorder, Mr. Stephen takes medications. He also visits with a mental health case manager each week, who is extremely supportive and has developed a solid relationship with Mr. Stephen. To help Mr. Stephen take his medications, a nurse at the nursing facility assisted him in making a chart to serve as a reminder. The nurse informed Mr. Stephen's case manager of the chart so that the case manager will review the chart with Mr. Stephen weekly. The nurse facility social worker also worked with Mr. Stephen to secure a primary care physician that accepts Medicare prior to discharge. The social worker helped Mr. Stephen set up an appointment with the doctor within 2 weeks of discharge from the nursing facility. Finally, Mr. Stephen has a niece who lives in the area who takes Mr. Stephen to appointments as well as social activities and support groups at the senior center. Mr. Stephen also requested that his niece assist with managing his finances, which alleviates a lot of anxiety. The niece agreed to inform the housing director about his condition and needs to help monitor his status. Staff members completed a home evaluation with him. Housing director installed bath support bars and found an apartment with a short carpet.
Victoria.
Hi, nice to meet you. I'm your day nurse. Are you feeling better?
Yeah, so far so good. Thanks for asking. I can't wait to go home.
Oh, that's good. By the way, we brought good news for you. So you'll be ready for discharge in 2 days.
Cool.
Okay, I'm glad I brought you joy. And I'm here with my partner, Alina. She's a social worker.
Hi, Lena.
Okay, so my job is to make sure that you have somebody to come pick you up and that you are safe at home and you have everything you need. So we're going to be just asking you a few questions for your discharge planning. Is that okay with you?
Absolutely.
Okay.
Okay, great. Okay, we'll start by you.
Me.
Yeah.
What about me? What do you want to know?
Like, are you feeling any pain anywhere, or is there anything who bring you like concern?
For now, I'm okay. I just had pain medication earlier, but so far so good for now. Yeah.
Okay, you're doing great. Okay, good news. So, do you have any family member around that can be of support, or do you live alone?
Well, I do live alone for now. I have a niece which is maybe a couple distance away from where I live, and well, my other relatives were not good, and some are just overseas, so it's quite far from me.
Okay, I'm sorry about that, and I'm glad your niece is here. So we need someone to be of support for you, because you need someone around that can help you get along. And we're gonna arrange for some support. My partner, she's gonna discuss with you about the assistance and support available that can be offered to you. So
Yeah. Okay. So do you have anything that you're worried about after going home?
Yeah, I think I'm not sure if my niece will pick me because I don't think if she's at school or she's working right now. I don't know.
Okay. Do you have her information so we can contact her?
Yeah, sure.
Yeah.
Her name is Janet. You can call her at 778-986-3171.
Okay, so we're gonna call her and just ask her if she will be able to help you out and make sure that you get home safely and all that. Okay, where do you live?
I live in White Rock.
What kind of house do you live in?
I just live in a small apartment.
Okay, and do you own the place or do you rent it?
I just went there. I couldn't afford, so much stuff. My life is a mess. I don't know what's going on.
Okay. So, Mr. Steven, are you financially stable?
Unfortunately not. I can barely pay a rent.
Okay.
I don't know, maybe you can help me?
Yeah, I could totally help you with that. I will, we'll look for something for you, suitable for you, and then I'll get somebody to come and look at your place to do a home evaluation if it's safe for you, and then you can go with that person to see if you like it.
Okay.
Okay.
With my current situation right now, I don't know what to do anymore.
Okay, are you willing to move?
If that would benefit me, yes.
Okay, so I would look for something suitable for you, and then I'll get someone to come and do a home evaluation before you move in, so to make sure it's safe for you. And hey, Mr. Steven, that's it. Do you have any question for me?
That's it. No.
No? Okay. Well, I'll go and contact your niece and see if she's able to come and pick you up in 2 days,
Okay,
and then I'll come back and inform you about.
cool, thank you so much.
Okay. Thank you.
Thank you. Okay, Mr. Steven. So I think everything is going to be sorted out pretty well. Okay, I have some stuff here to teach you about. This pamphlet will basically guide you on how to perform your hygiene, because it's very important to stay healthy and in a very clean environment, on how to perform your hand hygiene, like how many times you gotta do that, and then it also states the kinds of proper diets and nutritional diets you will be on. So in this work case, I'm going to make a referral to the dietitian that will guide you on that as well. And here it has the step-by-step on how to handle your working device. That will be more explained to you by the occupational therapist. I'm going to make all these referrals to you. So it says also here, on like the kind of exercises you do, like a range of motion exercises you do every day to keep your health well maintained and increase circulatory function in your health, because due to the frequent mobility, it's going to help a lot. And I hope you do pay more attention, and I hope you practice this like every day. And I'm going to refer some home care nurse that will go to the house sometimes to help you with it also, and teach your niece, if she's going to be visiting around, to teach you how to do this every day. I'm for sure it will be a great help. So I want you to take this book because it has like nice pictures, and I'll give you some video links also that will help you with it. Okay.
Cool, thank you.
Thank you. And I will call the occupational therapist. Do you have any questions?
Yes, I do. So, for my amputation, is there any sign and symptoms of infection that have to be reported, and what are they?
Okay, that's a good question. Thank you for asking. So basically, you want to report if there's any swollenness, if you're feeling extreme pain, if you're feeling any pain or weird feeling at all, if you see that the color is changing, like some bruises showing or redness or any discharge at all coming, you have to report to the healthcare facility immediately, so they can come and assess it for you to see if there's any sign of infection, so it can be taken care of really quickly. And then for the application, they're gonna be looking forward to provide you a prosthesis that you will use. But for now, just for you to get healed for some time, you will just have to you just have to adapt and manage and work with the wheelchair. And they'll also, I think the all occupational therapists will also provide you with some other assistive devices too. So yeah, just report on any of that, and I think it should be taken care of. Do you have any more questions?
So only like drainage, that's it? The drainage?
Yeah, if it's swelling,
Swollen.
you have pain,
Kind of in pain, but I think-
yeah, if it's severe,
Okay.
report it, and then don't avoid
Fever
spending too
maybe?
much. Okay,
Is fever need to be reported as well, or?
fever. Yeah, if you're feeling feverish, you just call so they can come assess you, because
Okay.
you will have a home care nurse that will come and assess
Oh, I
you.
see. I still have a home care
Yes,
now.
of
Okay.
course. Yeah.
All right. Cool.
Okay, take care. We'll check you more often. Okay.
Okay. Thank
If you
you.
need any help, don't hesitate to call for help. Okay.
I
Alright.
appreciate your help,
No
Victoria.
problem. Take care.
Thank you. You too.
Bye.
Bye.
5 minutes later.
Yes.
Hi, Mr. Steven, it's me. I just finished talking to your niece, and she agreed to come pick you up when you're ready to go home. Okay, so I was able to find you an apartment that is suited for your needs, and your niece also agreed to inform the housing director about your condition, and will be helping monitoring your status. And I did send your occupational therapist to your new home to do a home evaluation for you. So she'll come in and talk to you all about it in 5-10 minutes.
Okay. Cool. Thank you. Thank you. Yes. Come in.
Hi, Mr. Stevens.
Hi.
How are you doing today?
Good.
Good.
There's so much going on, but I'm also
So much
good.
yeah, lots of new things today.
Yeah.
So looking at your social worker referred me to you. My name is Julia. I'm going to be your occupational therapist, okay?
Hi, Julia.
So there's a lot of things I'm going to teach you today. I'm going to teach you how to use crutches. Do you know how to use crutches?
No,
No?
I haven't. It's gonna be my first time, so I don't know.
Okay, I'll teach you how to use crutches, and then I'll teach you some leg exercises also, so you can help the blood circulation in your legs, because you're going to be in the wheelchair and crutches a lot. And then I also did go to your home, your new apartment, and I assessed it. So it seems like a really nice place. They have an elevator, so you don't have to walk up the stairs to go to your apartment. In your apartment, there's lots of room to move around and to have your wheelchair there to get everywhere. Also in the bathroom, they do have the side rail, so it's easy to get on the toilet for you. And in the shower too, it's a nice walk-in shower, so you don't have to hop over anything. I'm just gonna put this down. So for your crutches, how you want to use them is you're gonna make sure they fit comfortably under your arms, and then you're just gonna put your hands on the bars down here, and then because your left leg is amputated, you're just gonna go and then kind of hop with it when you put the crutches forward. Does that make sense to you?
Yeah. Do I have to get a wheelchair as well?
Yes, you will also need a wheelchair just so you don't have to use the crutches all the time, because
Yeah.
it can get tiring
Okay.
usually.
That sounds good.
And then yeah, just for your wheelchair, you already know how to use it. Just make sure to put the brake locks on if you're gonna sit somewhere for a long time, so you don't go rolling anywhere. And then I'm also gonna teach you some leg exercises. So you're gonna sit in your wheelchair. You're gonna sit in your wheelchair, your chair, and then you're gonna bring your legs up so they're straight. So they're nice and straight, and then you're gonna rotate your feet
Like that?
up and down. You're gonna go up
Okay.
and down, and then you can go around in a circle.
Okay.
And then you can move it the other way in a circle. And then you're gonna wanna do this like probably 3 times a day. You can also move your legs up and down, get the blood circulating.
Okay.
Yeah. Do you have any questions for me?
Not for now. But are you still coming to my place once in a while, or?
Yeah,
What-
we can work out our schedule. I will come once a week, just to check up on you, see how you're doing. If you have any questions for me, if you need anything. Is that okay with you?
Yeah, okay, yeah.
Sounds good.
Okay.
I'll see you before your discharge and we'll chat again.
Alright, thank you. Thank you, Juliet.
Welcome. Have a good day.
You too. Bye.